About the screening of newborns. Hello parents. Today, we'll be providing you with essential information about newborn screening. This simple blood test can detect over 25 rare but serious conditions crucial for safeguarding your baby's health. This video will delve into what newborn screening is, why it's so critical, and how the process unfolds. Let's get started. A straightforward blood test is used for newborn screening. This particular blood test has the capability of detecting symptoms of at least 25 uncommon but critical illnesses that are not detectable prior to birth. It is also able to detect indicators before the manifestation of evident symptoms. When these problems are discovered at an early stage, treatment can also begin at an earlier stage. Treatment at an early stage can, in the majority of instances, avoid or lessen the impact of these illnesses, some of which are potentially extremely dangerous. It is for this reason that you will be provided newborn screening within the first 48 to 72 hours after the birth of your child. The screening of newborns can tell you whether or not your child is at a higher risk for a particular condition. To determine whether or not your infant is in fact suffering from a certain ailment, you will need to undergo additional tests. A large majority of infants are born in good health. In less than 1% of cases, the results of a newborn screening indicate that a baby is at an increased risk of a problem. Screening exams for newborns are performed to identify uncommon diseases and illnesses. The majority of children who are diagnosed with these problems come from families that have no history of the disorders in the past. Prior to the screening of newborns, information and written consent. A discussion about newborn screening will take place with you, and your physician or midwife will ask for your permission to carry out the test. You will be asked to sign a document or a newborn screening card if you provide your agreement to the procedure. It will be necessary for you to complete a decline of screening form in the event that you do not agree to the screening of newborns. In the event that your infant develops an illness at any point in time, it is essential to inform your child and family health nurse or your primary care physician that your infant did not undergo newborn screening. It is also possible that you will be asked whether the blood obtained from the screening test performed on your kid can be utilized for research in the future. Your choice is whether or not to consent to this. You have the ability to decline. In the event that you consent to the use of your baby's blood in research, the researchers will ensure that confidentiality is maintained regarding your baby's identification. The screening of newborns is completely free. You are not required to do so. Collecting a blood sample for the purpose of neonatal screening. When the midwife arrives, she will begin by warming your baby's heel, which she will typically do using your hand or a blanket. The heel of your infant will be pricked by the midwife, and a few drops of blood will be collected on a different type of filter paper. The filter paper is put through a drying process before being transported to a laboratory, where the blood of your infant is examined for a variety of disorders. It is possible that your local child and family health nurse or midwife will be able to obtain a blood sample from your infant at your residence if you were discharged from the hospital earlier than expected. In the event that this is not feasible, you will be required to travel your infant back to the medical facility in order to have a blood sample taken from them. It is important to make sure that the date of the newborn screening is documented in the Child Health and Development Record Book for your child. Your infant may experience less discomfort when the blood sample is collected if you breastfeed them or make skin-to-skin contact with them. It is possible to alleviate your child's discomfort by administering a very little amount of oral sucrose, which is a specialized sweet syrup, in the event that they are unable to be held skin-to-skin or breastfed. The outcomes of the newborn screening. In most cases, the results are made available approximately 2 weeks after the test, at which point they are delivered to either your midwife or the facility where your baby was made. The majority of infants have outcomes that are typical. Only in the event that there is an issue will you typically be informed about the findings of your baby's tests. In the event that the findings of your baby are determined to be abnormal, you will be called immediately and referred to a specialist for additional testing in order to diagnose the condition of your kid. Taking your child for this second round of testing as soon as possible is something that should not be delayed. Your infant will be able to begin therapy sooner if the problem that your infant is experiencing is diagnosed sooner. Should there be a need for additional screening of newborns? Rechecking the results of the newborn screening tests is necessary for certain infants. The following are some of the reasons why newborn screening needs to be repeated rather frequently. The screening test cannot be carried out since there is not enough blood. There was either no definite result from the initial screening test that was performed on your newborn, or the result was just slightly outside the usual range. Your infant was delivered either too soon or with a low birth weight on the day of birth. Donor blood transfusions were administered to your newborn child. Intermittent intravenous feeding was performed on your newborn before beginning regular breastfeeding or formula feeding. You have a set of identical twins or triplets with your newborn. In the event that your infant requires additional testing, your hospital or midwife will get in touch with you. In the event that you are requested to bring your child in for a second examination, it is imperative that you do so as quickly as possible. Thank you for tuning in to learn more about newborn screening. Taking this crucial step to protect your baby's health is commendable. If you found our video helpful, don't forget to like and subscribe to our channel. Wishing you and your little ones healthy days ahead.